Good morning and welcome to COVID-19 Vaccine and Employers webinar. I am Greg Wesley, Senior Vice President at the Medical College of Wisconsin and a member of the MMAC and GMC. It is an outstanding day to have the MMAC, the GMC, and the Milwaukee Business Journal partner on such an important topic for our community. They're not only co-hosting this webinar today, but have been engaged deeply over the past year in the COVID-19 response. I am deeply proud to be a part of a community where we're always striving to find ways to support our imperatives. The COVID-19 vaccine is one of the most important topics for business leaders, employers, and our economy as a whole. Medical experts have identified that in order for our community to open fully, we need 75% to 85% of all people to be vaccinated. This is how we achieve herd immunity, or what's also known as community immunity. In Wisconsin and in the Milwaukee area, medical experts have made it our goal to vaccinate 80% of our adult population. That means 3.7 million adults in Wisconsin and 578,000 adults in Milwaukee County. As of yesterday, Wisconsin's Department of Health Services reported that in Milwaukee County, about 19% or 181,049 adults have received at least a first dose of the COVID-19 vaccine. 9.5%, or about 89,000 adults, are fully vaccinated. Now, what that means is that we have a ways to go to reach that 80% community immunity number, and employers will play a critical role in that. Employees typically trust their employers to make sound decisions about an employee's health. We hope that this webinar and the toolkit that we'll share helps you to chart a plan to educate, build vaccine confidence, and reduce barriers for employees to get the vaccine. We have a great lineup today, including Greg Engel from the Wisconsin Department of Health Services, and Christensen from the North Shore Public Health North Shore Public Health Officer to provide local resources, Mark Goldstein to advise on HR and legal parameters, and my colleague Mara Lord to share how to build vaccine confidence with your employees. We're going to start out with a quick poll, and then I'm going to welcome Greg Engel to start us off.
Okay, thanks. Good morning, everybody, and thank you. Thanks, Greg, and thanks to all the members of the panel. My name is Greg Engel. I am with the Department of Health Services Vaccination Task Force, and I'm in charge of the operations and logistics for the distribution of the vaccine. And I'm not a public health expert or a clinical expert on the vaccine. I am an emergency manager by trade. My day job is with the Director of Planning and Preparedness with Wisconsin Emergency Management, and have been involved with the COVID-19 response in the State Emergency Operations Center, since going back to March of 2020. And then once the vaccine distribution started to ramp up in November and December, then that's just where I've been since then. So I'm going to talk a little bit today about the process of getting the vaccine out from the CDC out to the vaccinators, and then others can talk about some of the other aspects of vaccination. So I'm very pleased to actually say on a statewide level, as of this morning, we have actually administered over 2 million first doses in the state of Wisconsin. So over 2 million Wisconsinites have received at least one dose of the vaccine, and over 750,000 people have completed either the 2-dose regimen or have received the 1-dose Johnson & Johnson vaccine. So we are making a lot of progress, and it's speeding up, it's accelerating as we get more vaccine into the state and as we get more vaccinators involved. And we're just very, very pleased about the process. We're excited, headed into April and into May to continue to open up eligibility, to continue to stand up both employer-based clinics and community-based clinics, and just expand the opportunities for people to get vaccine. And we're really excited to partner with all of you to try to get the word out and get as many people as vaccinated as we possibly can. And our goal really is by midsummer to really have most Wisconsinites vaccinated and certainly eligible to get vaccinated and have the opportunity to get vaccinated. So first on the question of eligibility, and we did just recently announce yesterday that new eligible categories of populations will be eligible starting next week. Right now, we have, as you know, we started with the frontline healthcare workers and residents and staff of long-term care. Those were the first populations that became eligible in December. And we expanded to police and fire and emergency responders. And then in January, expanded to the over 65 population and have been really prioritizing the over 65 adults over the last several weeks. And then a few weeks ago, opened it up to educators, other essential workers, including transit workers, food service, 911, utilities, and some of those essential worker populations in a limited capacity, individuals in congregate care settings. So all of that has been a priority, and we're very pleased that since March 1, when we opened up those categories, we've been pretty successful at vaccinating most of our educator population, still working through childcare, and some of those other essential worker populations. And over 65 I think we're over 70% now. So we're ready to start expanding to other populations. And we announced that starting March 22nd, anybody with a certain medical condition will be eligible to receive the vaccine. And there's a long list of medical conditions, and all of that information is on the Department of Health Services website. That's really going to open it up to, we think, over 2 million Wisconsinites. It's really a significant number of people. And that's a great thing because we really want to open that up and get people vaccinated. And then May 1st is when we have said that by May 1st, all Wisconsinites 16 and older will be eligible to get vaccinated. And that's a target goal. We actually think, in my personal opinion, is this might happen sooner than that. So just keep an eye on media, keep an eye on the Department of Health Services website, because we believe that as the vaccine supply increases, we may even be able to open up that sooner. But May 1st is what we're targeting right now for everybody to be eligible. So in terms of process to get people vaccinated, we have registered well over 1,000 vaccinators around the state, and hundreds and hundreds of vaccinators are receiving vaccine every week from our state allocation through a process. The unfortunate thing is that our vaccine supply still is limited. We still have our demand for vaccine from our vaccinators is still 3 to 4 times what we have available to allocate each week. So that means most vaccinators are not receiving all the vaccine that they request, and many vaccinators are still receiving nothing. They're receiving 0 vaccine, unfortunately, on a weekly basis. So we are seeing increases, and we do expect that vaccine supply to increase over the next several weeks, but it is still limited. So what I want to stress is just because someone is eligible to get vaccinated doesn't necessarily mean that there is vaccine available in their community. And so we just need to counsel patients, and we are prioritizing. We are trying to get vaccine out as widely as possible, but still people may need to wait. And employers in certain cases may need to wait until that vaccine is available. Speaking specifically about employer-based vaccination, we rolled out a new process on Monday to dedicate a supply of vaccine for employer-based clinics. The problem we're encountering, we're hearing from vaccinators, is they wanted to work with employers to set up an on-site clinic and vaccinate all employees or a significant chunk of employees at one time. But it was very difficult to plan for that because on any given week, they'll submit the request and they may only receive a third or a quarter of what they request. And it's very difficult to plan ahead because they don't know what they're going to receive. So starting Monday, we have a process to allow vaccinators to submit a request for a specific employer-based clinic. They tell us the name of the employer, the location, the week that they would like to schedule the clinic, the number of doses they need, and some other information that helps us prioritize those requests. And then we will review those requests and we will approve them. We will not be able to necessarily fulfill all of them. So some of them we might have to say, well, we'll have to wait a week or wait 2 or 3 weeks. We're going to look at those requests based on the risk of that population, the type of business, where it's located, all those factors. We may have some calls, we may talk by phone just to try to understand a little bit better what that situation is as we go through that process. And then if that vaccinator receives that vaccine allocation, then they can go ahead and schedule that clinic. So what we're encouraging employers to do is to work with vaccinators, identify a vaccinator in your community. If you're interested in setting up an employer-based clinic, work with a vaccinator, and work out those details of how many people will get vaccinated, who they are, and where and when, and all those things, so that vaccinator can submit that request. There's a fact sheet that we have up on the Department of Health Services website that provides some information on that process and some links to some resources, some links to other resources at the CDC. And we're working on a more comprehensive guide for employers, but right now we basically have this one-page fact sheet that can certainly send that link out, and we can send that out to all the folks on this call if there's interest in that. But we definitely encourage you to get involved in that process. One of the considerations is that in terms of the number of doses, it's not necessarily the number of employees that you have, because they may have already, some of them may have gotten vaccinated, some of them may not want to get vaccinated. So just understanding that population before requesting the doses. So if you have 200 employees, maybe we only need vaccine for 100 or 120. So those are kind of some of the major updates that we have right now. We do have a tremendous number of resources on our Department of Health Services website and the CDC website for things like considerations when you set up a clinic, educating employees. We have flyers, we have language that you can use, for educational materials, all those things. And we're interested in learning about what other resources are needed and what other information, what questions that people have, so that we can craft those resources and craft those fact sheets to meet the needs of our stakeholders out there. So that is my update this morning, and I'm happy to take any questions or answer any specific requests for information that anybody might have about our process.
Thank you, Greg. And I think what we'd like to do is to, we'll get to questions and the Q&A as well. But we also have critical information by our other panelists. And why don't we let the panelists begin to present their materials, and then we'll come back through with questions or answers to questions that have been posed. That's okay.
Sounds good. Thank you.
Good morning. My name is Christensen, so I'm the director of the North Shore Health Department. I serve the communities from Shorewood up to Brown Deer, but am representing public health officers and departments across the region. And here to provide you a little bit of information about how we can support your vaccine efforts and be a resource for you locally. So I'm ready to move to the next slide. So just to set in terms of understanding about what local health departments do, we are responsible. We sit in largely counties, but often municipalities to serve and protect the health of the people in Wisconsin where they live, work, and play. There are 86 local health departments. And as this slide says, we're guided by state statutes along with community health assessments and improvement plans. And this figure gives you a sense of the scope of our work. In terms of COVID-19 response, which we've been working on for a year now, that sits in the area of infectious disease control, as well as emergency preparedness. But again, just the whole, and immunization now that we're talking about vaccine. So this again gives you a sense of the scope of work that we do and the assets that we bring to communities, as well as to employers in those communities. So please go ahead and move on. In Milwaukee County, there are 11 health departments. These are their names and their logos to make you familiar with those. My sense is if you've had connection with COVID response over the last year, you've probably been in touch with your local health department, as we have been the agencies responsible for contact tracing and disease investigation for COVID-19 cases in our county. We've also worked closely with the business community when there are cases of COVID in employers or in occupational settings to help understand the extent of those cases and potential outbreaks that might be the result of those. So helping to minimize those outbreaks and to provide resources for employers in terms of how to mitigate and manage those. So again, these are the 11 health departments. And now you can move on. Thank you. So let's talk a little bit about vaccine resources. I think Greg queued up this slide really well in terms of you may be wondering where you will find vaccinators in our region. And the Wisconsin Department of Health Services has a map on their website that will provide you with information about where those vaccinators are, but there's other resources as well. So starting nationally, CDC has a website called Vaccine Finder. If you Google Vaccine Finder, that is a way that you can identify where people are vaccinating currently in our area, as well as across the country, if you have offices outside of Wisconsin. And then, as I mentioned, the state of Wisconsin has a vaccine provider map. That's what you're seeing here on my slide, with the dots representing various vaccinators. And as Greg said, there's over 1,000 vaccinators in Wisconsin, which is a tremendous resource for all of us to be able to find a vaccinator. The challenge will be finding vaccine, as the vaccine is limited and vaccinators are not all receiving vaccine, and then the supplies that they're receiving are very limited. More locally, healthymke.com is a resource for information about vaccine, both in terms of the vaccine itself, but as well as forthcoming information about where in the Milwaukee area there'll be vaccine events and vaccinators as well. So again, those are resources if you're wondering, where do I go to even begin finding who is vaccinating in my area? And then more specifically, local health departments, all of us are currently vaccinating in some capacity, whether it's out of our offices or in larger clinics, all the way up to the Wisconsin Center, which is run by the city of Milwaukee and now FEMA. Those are larger scale sites where they're receiving fair numbers of doses of vaccine. And again, the public is able to go to those vaccines, including your employees, when they're eligible. There are other larger community level vaccine clinics in the area as well. There's a couple on the south side, as well as at UWM through Advocate Aurora. So there are more community sites coming online. Again, those are larger scale sites where the public can go, and certainly employees. I do want to mention that health systems are very actively engaged in vaccine. providing vaccine for their patients. Specifically, they have reached out to their patients, largely focused on people 65 and older, as a way for those patients to get vaccinated directly by healthcare providers in those health systems. And then as we move on to eligibility groups with certain medical conditions, health systems continue to play that active role in vaccinating their patients. And then there's a large network of pharmacies in our region that are also vaccinating. Walgreens participates in the federal retail pharmacy program, as does Kroger. And those pharmacies across the area really provide easy access points for people to receive vaccine. So again, it's a matter of tracking down where people can get vaccinated, and I think really educating employees. If you're encouraging them to seek out vaccine on their own and helping them to know where even to go to start to find a vaccinator in their area. So these are some resources for you to think of to answer those questions for people. So moving on to the next slide. I just want to talk about local health departments most specifically. So again, if you're having questions about, or if your employees have questions about, am I eligible? Obviously, websites are helpful. The state health department website has a lot of information answering those questions directly, but it does get confusing, the nuances of some of these eligibility criteria. And then there's also parameters around vaccine eligibility. For example, Pfizer is the only vaccine currently authorized for people 16 and 17 years old. So we have to also remember there's eligibility restrictions on the vaccines, especially those age restrictions. Availability, we've mentioned that a lot. So the big question will be, is vaccine available through these vaccinators? Again, local health departments have a pretty good sense of who in the local areas have vaccine and are looking for people to vaccinate. So oftentimes if you have employees that are just running into roadblocks, again, giving us a call and helping us to navigate who's got available vaccine is often a way to answer those questions. We can answer questions about the different types of vaccines. Again, whether that's you as the employer or your employees are just confused. Again, that's a resource that we provide. Expected side effects, contraindications, or clinical implications. What are the ingredients? And then, as Greg mentioned, if you're considering setting up a vaccine clinic, we can help determine and assess what some of those clinic needs are. As I've said, most of us have been vaccinating for some time, so we have a fair amount of lessons learned about what makes a smooth clinic, what resources are necessary. This vaccine, the COVID-19 vaccine, especially the 2-dose ones, are not the same as a flu shot clinic. So it's not a quick, easy in and out. There are a lot of elements with the vaccine to be cognizant of, as well as the observation periods. So if you've got questions about what makes an effective COVID-19 vaccine clinic, again, we can be that resource for you at that local health department level. Obviously, we are not medical providers and would direct anybody with specific questions about their own concerns or questions about their vaccine to their healthcare providers, because they will be the ones that have the definitive information about a person's medical condition and the vaccine and whether they should be taking the vaccine. So we would really direct everybody back to their own healthcare provider for those types of questions. But again, the ones above are some general questions that we can help answer. And again, that's what we hope to be, is that resource for you. Moving on. Yeah, so those are my slides for today. And as Greg said, we're happy to be available for questions at the end. So I'll move it on to Greg Goldstein then. Thank you.
Mark?
Thank you and good morning, and happy St. Patrick's Day, everyone. I thought that this slide captured pretty nicely this moment we're in, and always nice to lead with something positive. This is a photo taken at or near the Temple Bar in Dublin, and hopefully in years to come we can return to those kinds of festivities. But thinking about St. Patrick's Day also gave me an idea for how we can approach this vaccine question. Next slide, please. So it occurred to me, and we'll touch on this in more detail momentarily, that as we think about what it was to take medication as a child, we can also think about how that relates to this vaccine question, related to our workforce, related to people that are asking us about the topic. To be clear, I'm not talking about children here. I'm talking about how we engage with our employees. So let's get to the substance of the question. The big question is, can we mandate that our employees get vaccinated? And the short answer is yes. Now, it's a qualified yes, and lawyers are renowned for doing that, because the short answer is yes, you can mandate it. But there are a variety of exceptions, and there are some other practical considerations, and that's what I want to go through this morning. First of all, to the answer yes. Yes, you can mandate it, and especially if it's job related. In other words, and Greg touched on this, and Ann as well, if we're talking about assisted living, if we're talking about daycare, if we're talking about other places with vulnerable populations, there's every reason to mandate it. Now, what kind of accommodations might you provide employees related to that? Well, I've encouraged clients to have someone who acts as a vaccine concierge, taking available resources that Ann just listed and matching people up and identifying where to go and how to make an appointment and answering questions about vaccination. Again, short of advocating as to why vaccines are appropriate, some of that is our closely held personal beliefs that are probably not appropriate for the employer-employee conversation. But there's all sorts of questions out there, all sorts of misinformation and disinformation. And some of that, and I think Greg touched on this, or maybe Greg at the outset, this idea of being a trusted resource to your employees is a valuable thing to do. You can also provide the time off for people to get a vaccine, or as Greg indicated, go about setting up an on-site clinic or making arrangements for that. So there are lots of things you can do to kind of get people from unsure, unknowing to yes. And I'll say this, we did some early surveys with clients probably a month ago, and employees were split really 50-50 on whether they were going to get the vaccine. If we need to get to the numbers that Greg indicated at the outset, the 70 or 80% number, we have the ability to, through education and facilitation, to bring more people along. And that's especially true if we're dealing with, as I said, vulnerable populations. So let's get to a couple of the key questions that come up in this process. Number one, can I ask if an employee has been vaccinated? The answer is yes, absolutely, you can ask. You cannot ask why they were vaccinated, or you should not ask why they were vaccinated. That gets into questions about whether they have an underlying health condition or other kinds of information that you may not be privy to or want to be privy to. Second question is, can I require proof that they've been vaccinated? Again, the answer is yes. The question here is how far you want to go in demanding proof, much like the mandate I just mentioned. And I'll leave that up to you as to how aggressive you want to be in that regard. A third question is, can I ask why they have not been vaccinated? And the answer here is no. We'll get in a moment to the reasons why someone may not have been vaccinated. But fundamentally, you get into one of two areas. One is a very sensitive issue of politics or philosophy or religion. The other might very well be that they have an underlying health condition. And what you then turn it into is a disability-related inquiry, which invokes all the protections of the ADA and so on. And that's probably not territory you want to go to. Number one, I don't think you're in the position to offer them much in terms of an accommodation to get vaccinated. And again, it's probably just not germane to the ultimate question, which is, can you bring them along to vaccination? So let's get to the legal exceptions, and there are two. The first one is someone who has underlying health issues. Now, again, these can be varied, and there can be lots of different or approaches to why an underlying health issue may be a reason not to get vaccinated. But fundamentally, that's not your determination, and that's between the employee and their physician. And it's probably best to just leave it at that. One question that comes up an awful lot, and an example of what I just mentioned, is a pregnant employee. The science is conflicting. To my understanding, there's really no evidence that vaccination is a risk for a pregnant employee, but don't take report. And to be honest with you, this is so new, and it just, there's not enough data to really make that decision conclusively, and you don't want to be in the position of making that decision conclusively or making that assertion conclusively. The second legal exception is sincerely held religious beliefs. And this is a little bit more complicated. What this fundamentally relates to is not economic philosophies or personal preferences or other things. This relates to, does someone have a sincerely held religious belief that says that vaccination is not appropriate? And again, there's only so far you can push on this. At some point, you're not going to persuade them. It's dangerous territory to get into, but you just have to broach, is it sincerely held? And does it relate not just to a religion, but to a belief that prohibits vaccination? So those are the two exceptions from a legal standpoint: health issues and a sincerely held religious belief. There are a few other practical considerations. First of all, and this has changed in the 24 hours since I put this slide together, do they qualify? Now, as you heard from Greg early on, a whole lot more people qualify starting Monday than used to. In fact, if you read this morning's journal, 32% of Wisconsinites are overweight or obese, and I think another 32% are overweight or obese. So that's about 60% if I'm doing the math or if I'm interpreting that correctly. So a whole bunch of people just qualified for better or for worse. That then just got a whole lot easier than the question posed yesterday. But the larger practical issue is, if you're going to mandate this, if you're going to require that people get vaccinated because, well, for any number of good reasons, and the result is people are quitting or you're terminating them, you now have to staff up, and that presents a whole host of other challenges. So we come to what I'll call the spectrum of approaches here. And this is on the next slide. And as we transition to this, let me just make one other point. For folks who cannot get vaccinated or opt not to get vaccinated, there are a variety of approaches that fit on this spectrum. For example, continued social distancing, continued mask wearing, non-customer facing positions, continued remote work. We can debate whether some of this is practical, whether it's possible, whether some of it might be actually an incentive to not get vaccinated, like continued remote work, for example. But just know that there are a variety of things that you can bring into play for folks who are not vaccinated. One of the questions we'll touch on in a moment is, when do we take the masks off? And I've had this question from clients about, well, geez, if everyone gets vaccinated, does that mean we can reward everyone by all taking our masks off? The short answer is no, for at least two reasons. One is we're just not there yet. And the second is that you will not get to 100%. You may not get to 80% in terms of your own workforce with masks. And it really took us several months to get to the place where masks were acceptable and used commonly. And we just don't want to be too quick to abandon that. So the idea of masks on or off as an incentive or as a penalty, that's a bit of a tricky one. The spectrum we have here, the spectrum I've created, goes from mandate on the left to educate on the right. And I would suggest to you that there are options all along this spectrum. What some business owners are going to be sad to hear is that there are fewer levers than you thought that you could push. And it's really more about cajoling and incentivizing and encouraging than it is about penalizing and mandating. But we've talked about the items on the left, and I'll just go into them a little bit further. Number one, we can, by mandating or penalizing, we can offer things to other people. This is the flip side of the incentivize circle that we don't offer necessarily to folks on the who are not getting the vaccine. For example, we can offer PTO to people, or as I said, offer to not wear masks. The challenge here is that, as I mentioned a moment ago, for people who can't or have a religious objection, we can't necessarily shun them or stigmatize them, or we shouldn't, because they are unable or unwilling to get the vaccine. So it becomes a little messier in that regard. In terms of incentives and the cajoling, there are gift cards. There is the offering of PTO, either A, to get the vaccine, or B, just as a reward and a thank you for employees who are willing to get the vaccine. I can imagine, for example, take Friday afternoon off, get the vaccine, and don't come back. Enjoy the afternoon. Things like that can opt to incentivize or encourage. There are two legal principles here that are make it a little complicated. The first one is what I mentioned, which is we cannot offer incentives that we don't also offer to people who, for health or other reasons, can't get the vaccine. So, for example, if we offer Friday afternoon off for someone who's getting the vaccine as a reward, if someone for health reasons cannot get the vaccine, we have to offer it there too. And that makes it a little more complicated. The second is, and if your lawyer doesn't tell you this, your accountant will, there are always tax consequences to gifts. So gift cards and whatnot do come with a related tax consequence. So we find ourselves in the buckets of encourage, facilitate, educate. And with facilitate, I wanted to point to two things. Number one is what I mentioned a moment ago, this idea of becoming the vaccine concierge. There are a lot of folks who still just don't know, how do I do this? Where do I go? Is there a difference between the various vaccines and who's giving what? And as I said at the outset, you're not necessarily a medical professional, so be cautious as to how much you offer up. But the common thinking these days is the best vaccine is the one that is put in your arm today. So between Moderna and Pfizer and so on, if you can get them to an appointment sooner rather than later, that serves them and that serves you as well. Also in this bucket is what Greg mentioned, which is this idea of getting an on-site clinic, an employee-based clinic on-site, and making it really, really easy for folks to get the vaccine. And then finally, educating folks about safety, about the consequences of not getting a vaccine, where to get it and how they qualify. One of the great benefits of what I do, what we do, is we hear stories from all industries all day, all week. And the stories we hear about people who, to this day, get sick, have long haul issues, they're severe, they're real, and important that we keep that front of mind as we go through this process. So I look forward to taking your questions, and thank you for the opportunity to be part of this panel today.
Mar?
Thank you so much, Greg and Mark. So Mark, perfect lead-ins to everything that I'm going to be talking about. And you can see that a poll just popped up on your screen asking for employees in your workforce who have not yet decided to be vaccinated, what are the main reasons you're hearing? And what we saw in the poll in the very beginning is that 29% of you said that less than 10% of your workforce either have received the vaccine or are intending to get the vaccine. So what I'd like to share with you are just some of the research that we found to build vaccine confidence and some of the tools as well. I also want to mention that all of this work that I'm bringing up is part of the Unified Emergency Operations Center, the UEOC, which is also a co-sponsor of this webinar. And the UEOC is made up of, it's a public health collaborative and public health officials from across Milwaukee County, as well as other representatives from Milwaukee County, City of Milwaukee, all of the health systems and health centers across the region, private sector as well. As Greg Wesley mentioned earlier, MMAC, GMC have been involved in this, and then the Medical College of Wisconsin as well. Next slide, please. Next, Chris. So as Chris is moving, oh, there we go. So just a reiteration, we have a big goal in this community. What I wanted to mention though is we don't just have a quantitative goal, we have a qualitative goal as well. And that is to honor people and their personal choice. And for everything that you've heard, I mean, it's often difficult to thread that very narrow eye of the needle to say, we want to honor people and their personal choice, but we really want them to get the vaccine. So what I'm going to share with you is just a number of ideas on how we can do both. Next. So here is national research on vaccine intent. And I want to point out the language on this slide, which is so critical. So those who are not intending to get the vaccine has ranged around 20 to 30% over time. You can see on the very left-hand side in the orange bar that the number of individuals who are reporting that they're willing to get the vaccine continues to go up. And that's really the questioning, open, intending categories on the right-hand side here. But we still, just as you reported, we still have a large number of people who are not either not intending or questioning. The language here is important. I've seen a number of reports that say people who are resistant, people who are against, people who are anti-vaxxers. We encourage you to stay away from that type of language. We don't need to create more division. Instead, this is the language that we're recommending. So those who are not intending at this time, those who are questioning may need some more information. Those who are open but uncertain, and again, will be motivated by different things. And then those who are intending, and now we'll have a category of those who are intending and who have received the vaccine. I also want to point out on the slide, movable middle is a really critical population, and I'll talk more about that in a moment. Next, please. So here on this slide, you see a breakdown of the data for vaccine intent by race, ethnicity, and age. And you could follow any one of those color blocks and see how different they are based on race, ethnicity, and age. And the three that I'm going to talk about in detail in the next slide is those individuals who are white, Black, Hispanic, and then 18 to 34. Those are just really critical populations that we need to reach within the next couple of weeks and months. Next, please. So going back to this concept of movable middle, these are the individuals who, again, this is based on national data from the Ad Council. They've done tremendous work identifying the, how do we get to people's hearts and minds. But then it's been validated also by Pew Charitable Trust and the Kaiser Family Foundation, which has a really nice vaccine monitor that they've been updating every couple of weeks. So you can see that the demographics of the individuals here, white, Hispanic, and Black women, largely aged 35 to 54, and in individuals who are employed as essential workers. So these individuals are making up the largest population of individuals who are saying, I'm either questioning or I'm open but uncertain. But these are also the most likely to move into intending. So we've been focusing a lot of our time here. Next slide, please. So these are the reasons that people that are being reported that people are hesitant about the vaccine. And I think we just saw it in the poll that came up. Concerns about safety and side effects, speed of the process and long-term effects, not knowing what those are, mistrust because of disproportionate harm from the pandemic and legacy of discrimination and exploitation, distrust in political and economic motives. And then the last one is one that continues to rise in our awareness is hassle of getting the vaccine. And as Ann Christensen mentioned earlier, it's not as simple as the flu shot. It does take a little bit more effort, but I have to say it takes very nominal effort to get the vaccine. But people are speaking out about that. Next, please. So here's what we found resonates for people. So first of all, acknowledging individuals' concerns and approaching them with empathy. This resonates so much better than talking from a place of negativity or fear. Next, reflecting on the moments missed. And it's not in this deck, but in a survey that we've been using, the top 3 moments that people missed the most, and people over 70% of those surveyed were reporting that 1, it's time with family and friends, just that connection again. 2, it's going to restaurants, stores, and events. And 3, it's being able to go somewhere without your mask on. So those top reasons. And then another one that rises up, especially for African American and Black and Hispanic populations, is going to church and being with the congregation. 3rd, emphasizing the protection for self and others. And then 4, using a positive tone. And I cannot emphasize these enough. You can see on the left-hand side of the screen, these were the messaging elements that were rejected across audiences. Even talking about getting back to normal because normal is different for everybody. So just paying attention to the language is really important. And in the toolkit that I'll present to you, we do have a slide in there that includes say this, not that. And it takes a number of the language pieces that we've been hearing and wraps all of these 4 messaging elements around them and makes recommendations for how you can approach your employees. Next slide, please. So I'd like to introduce just the very highest level of this employer toolkit that we are offering. And that goes, I think it's live now on the MMAC website. Chris can put, here we go, he can put the link in the chat. So first of all, we are suggesting this checklist. So make a plan, consider those human resources and legal issues that Mark Goldstein just presented on. Take time to build that vaccine confidence, take time with people, take time for town halls, use the materials that we're presenting to you. And again, many of them in this toolkit, you can put your logos on them. You can take our logos off, please use them at will. We'll continue to update those. Review the best practices for employee communication, because again, messaging matters. Understand who is eligible. We put the eligibility link in the chat for you, and then understand where employees can get vaccinated. And we know that many of you are considering on-site clinics or partnering with somebody to do so. And this checklist is in the toolkit. Next slide, please. And then finally, here is just, and the link is in the left-hand side. Here's just a very quick example of some of the resources that will be in the toolkit. So on the, there are many more infographics in the toolkit and many resources from the public health, the Network for Public Health Law, the Health Action Alliance, Ad Council, etc. But just to give you an example, let's get back to who and what we miss most. Again, that motivator of connecting with people is so strong. Lining up the myths and just quickly, moving to facts. That's another piece that you can send out to people. COVID-19 vaccines at a glance, keeping it really simple so you can share it. So thank you so much. We hope the toolkit is very useful for you. Greg?
Thank you, Mara. For all the panelists, if you can come back on screen, that would be fantastic. We're going to open it up. We have about 13 minutes here for Q&A. What I would encourage attendees to do is to put your questions in the Q&A session. Some have put a few in the chat. And what I'm going to do is to see if we can kind of organize some of the questions that have been presented. For Greg Engel, there's a question that goes here. It says, it's been publicized that the Wisconsin Department of Health Services is now following the CDC recommendations for vaccine prioritization. Some industry employees are part of the CDC's recommended phase 1B that have not been included in Wisconsin's 1B. Will those people be eligible on March 22nd when the state begins phase 1C, or do they have to wait until vaccines become available or eligible for all adults? Greg?
So yeah, thanks for the question. We are coordinating and trying to align with CDC's guidelines. However, we're not in 100%, our guidelines are not 100% the same as CDC's. We also have a state disaster medical advisory committee of medical experts that takes the CDC guidance and sort of Wisconsinizes it. And that's what we've been using that expertise to inform our eligibility guidelines, which are not necessarily exactly what the SDMAC always, the timelines and things are not exactly what is being advised by CDC. So it's not 100% alignment, but we are definitely following those guidelines. On March 22nd, the eligibility that is opening up on March 22nd is for people with medical conditions, regardless of their employment status. So it's folks with a list of medical conditions that you can find on the Department of Health Services website. And this will open it up to a significant number of new individuals. There is no plan right now that we're ready to announce that would open it up to additional essential workers. Right now, the next step is March 22nd with the medical conditions. There may be additional expansion of eligibility after that as we get into April, but more to come on that. So right now, in terms of the employer categories that are eligible, they're the ones that were announced previously, and this includes food service, which is now expanded to restaurant workers, educators in childcare and higher education is part of that as well, and some other industries. And really this is based on a risk assessment. We recognize that there are many businesses out there that are essential. So we're clear to say that this is not just essential workers, this is a subset of all of those essential workers out there. And we know that there are many essential workers and businesses that are not eligible under those guidelines right now. And it simply is just a matter of the lack of supply, that we were really trying to expand the eligibility to make sure that we'd be able to vaccinate those folks within the very limited supply that we have.
Thank you, Greg. We have a poll here for the participants, and I would encourage you to take a look at that poll and respond to it. One more question for you, Greg. We have a question here about real estate and on-site maintenance workers being deemed essential workers at the beginning of COVID, but now with the vaccine eligibility, they're not being deemed as essential workers. And the question is, can you tell the person why, or are they actually reading the information from an eligibility standpoint correctly?
Yeah, I mean, I'll just reiterate that just because a certain employer population is, or worker population is not eligible for vaccine does not mean they're not an essential worker. That there are many essential worker categories that are not currently eligible because the supply is just not there to expand that. So yeah, those real estate are not currently eligible. Maintenance workers would be eligible if they work in a healthcare setting, or they work in a setting that supports essential healthcare services or some of those other services that are eligible. But really, again, it comes down to, we had to look at a risk assessments of those workers that were at highest risk and prioritize. And unfortunately, we weren't able to put all essential workers on that eligibility category.
Okay. So I'm not going to be able to get to every question, but I'm going to do my best. I'm going to try to organize it in a way that allows for each of the panelists to answer a couple of the questions here. It looks like this is for you, Mark. It's an employer-specific question. It says, can you ask what element or tenet of their religion prevents them from getting the vaccine?
You can, to the extent that it gets at that question about what aspect relates to vaccination. But as I said earlier, it's a little complicated because I'm not sure in the best position to analyze the response or to do anything with it. So you're really getting at how sincerely held is this belief?
Okay. Here's another question. I think maybe Anne, I might put this one to you. Hopefully it's right. It says, what precautions do you recommend employers take when opening their offices back up for in-person work? Wait until herd immunity is reached? Vaccinated employees only? Mask wearing, social distancing practices still in place, or other?
Yeah. I mean, there's some element of all of the above in terms of those precautions that we would recommend. Certainly having a sizable number of employees vaccinated will give peace of mind that there's some protection from that vaccination, but we're going to continue to recommend those other measures like mask wearing, physical distancing between employees. Again, if an employer is able to provide some kind of work from home options, that depopulates the office and again minimizes transmission that's going to occur. So again, the answer really is to continue what is being done while vaccine is being distributed out there. And at this point in time, when we have relatively lower levels of vaccine across the population, you know, again, those mask wearing, physical distancing measures are all that much more important. And again, some of that is a discussion between the employer and employees in terms of, you know, what can the business handle in terms of continuing to offer remote work for their employees, as that is going to be the safest environment. But again, many businesses have gone back into in-person office settings and have put in place mitigation that that is limiting the spread of COVID in their facilities.
Mara, you put something in the actual to the attendees around data and pregnant women. Can you speak to that a little bit? I think that's been a big question that's been presented in a number of settings, and maybe just sharing that information with employers, please.
Yeah, I actually believe Dr. Raymond is on the line, and Dr. Raymond included that in the chat. There is new research, and I think what he put, I just want to take a look at it because I don't know that he can speak up in here. But he said that there's new data showing that 30,000 pregnant women who received mRNA COVID-19 vaccines had minimal side effects that were not different from non-pregnant people. And he also included the link to that article. So we do have that in some of our infographics as well as a myth and a fact. So that's an important talking point for sure.
Thank you. All right. So it looks like another question here. It looks like more of a question around eligibility for when you get to the clinic. So I'm just going to open it up for the panelists, and whoever feels most appropriate to answer it, please do. The question is, I was told that we would not be able to have the COVID vaccine clinic due to temp requirements for the vaccine. Has that changed?
This is Anne. I can start with that question, and then if Greg has follow-up, he can answer. Again, a COVID-19 vaccine clinic is a clinic that should be run by trained medical providers. The state has approved eligibility for about 1,000 vaccinators. So linking with somebody who is already eligible will ensure that they've got the training and the resources to provide a safe clinic for your employees. So that's the best strategy to go through one of those eligible providers. And I know that there are a number of those out there that are looking to help and support businesses. So that would be my advice on making sure your clinic is safe and effective, is to work with somebody who is currently trained to provide those vaccines.
Thank you, Anne. One more question here. I think we have a couple of more minutes before we close. This looks like an employer-related question. Is there any information about whether and how much more effective an on-site employer clinic is in getting employees vaccinated? In short, how important is it for an employer to set up an on-site clinic?
Well, I'll just offer 2 sentences and then let Mara take the rest of it if she's willing. I'll say it's very important based upon what we know, if it's possible to do so. There's so much question out there about whether and how. To the extent you can facilitate that, it serves your employees and it serves your operations.
Yeah, I think I would just add, and Anne is probably even better for this, that just reducing barriers, right, to getting employees to vaccine, whether that is partnering with someone for on-site if you have a very large staff, or partnering with somebody who's not on-site, but ensuring, that there is quick access to vaccine. I think finding the different ways that work for your business to reduce those barriers is the most critical.
I would agree with that. Yep.
So Greg, Anne, Mark, Mara, to the MMAC, to the GMC, and also to the Business Journal, thank you for hosting today's seminar and participating in today's webinar, not seminar, but webinar. And we hope that everyone has found this information useful. It has been recorded and will be available on MMAC's YouTube channel. We thank you for your time. Please continue to share information. I'll pick up on one point that Mara made. This has been tough, but the more that we can remain optimistic, the better. And we believe the light is at the end of the tunnel with the vaccine. And we thank you all for your time. Have a great day, everyone.
Thank you.